Welcome to Spectator MD. I'm Marvin Base, your host. Today we will explore the complex and deeply human topic of addiction. We will focus on the different types and how they all relate to change the brain. We will try and shed some light on the challenges and triumphs of overcoming addiction and the paths to recovery. Today I have the pleasure of being joined by Joshua Harrell, a licensed mental health counselor with over 15 years of experience. Josh runs a private practice in Nassau and Suffolk County in New York, where he works with mainly young adults facing challenges with addiction, anxiety, and depression. He focuses on helping his clients better understand the nature of their struggles while giving them the tools and the coping strategies they need to move forward. The heart of his work is guiding people to peel back the layers and gain insight and make a lasting change. Josh, nice to have you here. Thanks for coming.
Here, Marv.
Thanks. So let's talk addiction, man. Addiction to drugs, addiction to alcohol, addiction to food, addiction to gambling, addiction to sex, addiction to addictions, okay? Forgive me for my intensity, but this subject hits home in more ways than one. Okay? So let's talk a little bit about yourself and how you wound up where you are today.
Sure. It's a very intense subject, and as I've gone through my own experience and spoken with others, you realize it's not something that discriminates, especially in this day and age. You touched on a couple of things as far as understanding substance-related addictions and behavior addictions. So really, it's understanding that across the board that people are impacted by this, if not by themselves, but by family members. I myself am somebody who got into the field following my own recovery. So I'm currently someone who's been sober for just over 9 years. It has not been an easy road. I'm about 40 years old now. I first started exploring recovery in my late teens. So it took quite a while to get to this point. And you touched on a few different subjects in recovery. What I've learned in my time is that most people who struggle with some sort of addiction, it's usually not isolated to one particular addiction. So it's a really interesting topic that I think a lot of people would benefit from having a little bit more in-depth understanding of how these things come to be, how they manifest, and, how do we deal with it?
So obviously now you're sober for 9 years. So how, I guess you felt the need to go into this field, right? After you went through recovery. So explain kind of like what your feelings were after recovery and why you felt compelled to pursue this as your career.
Sure. So this is technically a career change for me. Initially, I worked in finance. So a lot of the work I did had nothing to do with this subject matter, aside from the fact that many people in the field themselves struggled with their own addictions. Some of the most successful people in my office were arguably some of the sickest people that I knew. So it was really interesting to kind of watch that unfold. I ended up in finance at a time in my life because my values, my belief systems were influenced by the place I grew up in a, predominantly wealthy neighborhood on Long Island. I was taught that happiness often comes in the form of money and financial success. And after pursuing my degree and working in the world of finance, lo and behold, 2008 came, the financial crash, and I had a come to Jesus moment about where I was at in my life and what I was doing and how I ended up there. After hitting my own proverbial bottom in some of my own struggles around addiction and getting involved in some recovery, meeting with a therapist, exploring self-help groups like AA, I started to not only learn more about myself, but really understand how impactful this work was, how important it was, and I felt a sense of fulfillment not only in doing my own recovery in the work, but decided to start doing some volunteer work and realized that I was getting more fulfillment out of doing volunteer work and not getting paid than I ever was working in the world of finance. And eventually I asked myself the age-old question of, if money was not an issue in my life, what would I want to do with my time? The answer was really clear. Fast forward, here we are.
And that's really what it's all about, right? I mean, really doing and having a purpose in your life, a usefulness, right? Helping yourself, helping your fellow man, right? And not thinking about it, right? So let's start by defining addiction.
Sure.
So define it for me.
A lot of people wonder, how do you draw the parallel of like what's normal, what's liking something versus like what is an addictive behavior? Often I will refer to addiction as something that can cause chaos and crisis in your life, something that sometimes shrinks the scope of your life, right? The things you're interested in, the things that you derive pleasure from become less and less. Usually different indicators for addiction from a clinical standpoint, right? Like you gain some sort of tolerance, right? Like you need more and more of that particular substance to derive the desired effect, right? When you don't have that substance, you find yourself going through a lot of physical, psychological, emotional discomfort, also known as withdrawal. To really simplify understanding addiction, there are two components to it. One is the obsession, right? I think another, the cognitive piece, and then the compulsion is the action, acting on it. I take another. For a lot of people, they start to understand that they are addicted when a line gets crossed such that they are no longer necessarily enjoying the substance or having fun, but they are now using it to maintain some sort of homeostasis, to feel okay, to not feel sick. It's not even about deriving pleasure anymore. And that's where people start to have the light bulb go off, where they realize that they are pursuing a particular substance, a particular action or behavior, even though they woke up that morning swearing to themselves they didn't want to or they had no intention. And by the end of the day, finding that they could not help but continue to ruminate or think about that thing and feeling that, their will has been broken or that they can't control the need or that they can't feel okay without that particular thing in their life, only to find themselves repeating the cycle, feeling guilt and shame about it, and then really getting stuck in this, deadly cycle.
So basically, it would be the continued compulsive use of a drug or behavior despite harm to self or others.
Sure.
Right? I mean, fair to say?
Yeah, absolutely.
Yeah. So what are the differences between drug addictions and behavioral addictions?
So one of the main differences, right, is that one, you are putting a particular substance in your body. The other, you are not putting a foreign substance in your body. What the two really have in common is that they both affect the same neural pathways in the brain, right? The areas of your brain that are impacted by your anticipation or your motivation, right? I think there's a misconception. So everybody often talks about dopamine, right? And how is dopamine affected by drugs or your behaviors versus what is actually happening in the brain when you put these things in there. So what you will see, and there are plenty of studies that document this, right? There are MRI machines, right? There's a lot of research, millions upon millions of dollars that goes into this. There are situations where people who have behavioral addictions are just as impacted, if not further impacted, despite the fact that they're not actually putting substances in their body.
Yep.
Right? You can take an MRI machine and see the structural changes in the brain, in gray matter, in different pathways when these people are shown photos of their particular behavior or their particular drug of choice, even without inserting the particular drug. Because let's face it, drug addiction, substance addiction, behavioral addictions, it's not always about the actual drug or behavior itself, right? It's about the time spent pursuing. It's about the ritualization of it, right? The actual getting high piece happens kind of like that, right? But for somebody who's using, right, it's about anticipating the loss of the drug. It's about getting ready to call that person to connect. It's about planning your night around getting high and using. So those are the pieces that kind of play a role in hijacking your reward circuitry, which is directly linked to your dopamine receptors.
Yeah, so dopamine, it's really about wanting and craving is really instead of having.
It's the obsession piece, right? The obsession.
Absolutely.
Thinking about it.
Yeah.
That's where you kind of get hijacked.
Yeah.
Right?
Right.
And go ahead.
No, go ahead.
One of the problems for a lot of people, right, what they don't understand, right, like dopamine is a very healthy, life-sustainable, like thing that we have that we need in our bodies that tends to motivate us, that tends to drive us towards certain actions, towards certain behaviors, right? If I am craving some ice cream or some sugar, right? All right, I have this little dopamine surge that I get from it. Maybe it's like a, 4 or 5% dopamine surge, right? If I am listening to some music, right? My body gives me this natural reward. I have this desire, this craving for it. Maybe it's around 6, 7%, right? Sex, right? The desire for a sexual partner or having an orgasm, right? I might achieve a natural dopamine surge of 10 or 12%. When you start introducing substances.
Excuse me for interrupting, but they say that dopamine, if you eat a piece of chocolate, your dopamine level goes up 50%. If you have sex, it goes up 100%.
Okay.
If you smoke a cigarette with nicotine, it goes up 150%. Okay. Obviously, if you do meth or methamphetamines, it's 1,000%. But it boggles at me that smoking a cigarette gives you more of a dopamine hit than sex, okay? So, obviously, from what you're saying is that whatever it is, the drug, the behavior, everything, there's an underlying biochemical and biological underpinning to everything, which is dopamine, right? I don't know if you read Anna Lemke's book, Dopamine Nation. Right?
Some highlights from it. I haven't read it entirely.
Right. So she's a renowned psychiatrist in Stanford, right? And she goes over this pretty clearly and simply, right? On how our brain, okay, first of all, the pleasure and the pain pathways are located in the same area of the brain, right? And we're at a balance, and everyone has a level of dopamine that is innate, that they're born with, right? Some people, it's lower, and you'll see that in people who are usually depressed. They would have a lower level of dopamine chronically, okay? And that would bring about anxiety or depression or what have you. So once you take the dopamine hit, okay, there's an equal and opposite reaction. So for every dopamine hit, there's a pain hit because the body always wants to get back
to equilibrium.
To homeostasis, right? Mm-hmm. Equilibrium, homeostasis.
The higher you get, the harder you fall.
Right? So if you just, let's say you eat a piece of chocolate, right? And you get a little hit. If you just wait, okay, it'll balance, it'll take the pain and then it'll balance out. If you eat the piece of chocolate and you continue to eat a piece of chocolate, now you're taking a hit, and the pain gets worse and worse and worse. So now it never truly balances back to baseline because you're disrupting the balance of the dopamine, right? Mm-hmm. Which we know obviously is the neurotransmitter that goes from presynaptic to postsynaptic, neurons. So what happens is that it's almost like you're, sabotaging your brain because of this. So what happens is, for what she says, is that for people who are severely addicted, what they did was they kind of broke their brain, to put it simply.
It's been hijacked.
Right?
It's essentially been hijacked.
They've jacked up dopamine so much that now they're in a chronic dopamine deficit, right? Chronic withdrawal. And even if they lay off for weeks or months or even years, there's a baseline level that will never be achieved. Now, in most people, right, if they lay off for a certain amount of time, okay, we start to balance out, right? She talks about a dopamine fast. I don't know if you've...
Yeah,
right?
of course. I have a lot of young adults who struggle with a ton of behavioral addictions, cell phones, social media, gaming, and talk to them about what does a dopamine fast look like for them, right? To not get on their phone as soon as they wake up in the morning, right? To give their body a chance to kind of get to equilibrium for a certain amount of time, to limit their use and exposure. I mean, this is part of why, nearly 10% of people who consider themselves gamers have problematic patterns with gaming.
Yeah. So what's the dopamine fast? Can you elaborate on that? Or?
Yeah, basically it's understanding, right? Like as if you would have a food fast, right? It's basically taking out of your life the activities that give you those dopamine hits or dopamine spikes, right? So limiting access to your cell phone, right? Not watching pornography, choosing not to, masturbate for some period of time, choosing not to engage in high intensity activities that could trigger that. In this case, obviously, drugs and alcohol could be a dopamine fast. Certain foods to stay away from could be part of a dopamine fast as well.
Yeah, so, in her book, she talks about a 30-day fast. And this is what she typically does. She tells the client or the patient to refrain from the use of the drug or behavior for 30 days. Obviously, she says, the first 2 weeks are basically going to suck.
It's withdrawal.
Okay? I mean, they're going to suck. You're going to feel anxious, depressed, sleepless nights, the whole slew.
Irritability, frustration, change
Everything.
in appetite.
Because the balance now is so disrupted.
Sure.
Okay? So if you can get through those 2 weeks, okay, the sun will start to shine, right? And the natural dopamine balance is going to start to level off, okay? And she talks about, let's say, the third or fourth week, okay, how people feel much better, right? They feel much better because now the balance is returning to homeostasis, right?
So I would agree. The only caveat I will say to that is understanding that for a lot of people who do struggle with different addictions, about 50% of people who qualify for a particular substance addiction also have some sort of co-occurring mental health issue, right? So a lot of people who are using drugs, right, the old adage, right, they're not good people doing bad things, right? They're sick people often trying to get well. A lot of people will use particular substances to try to self-medicate, right? Alcohol, marijuana, THC in the short term can be really effective for helping people to treat their symptoms of discomfort, although in the long run, they will get worse and worse. So in the case where you're talking about this, 30-day withdrawal period, for a lot of people who do have other undiagnosed mental health issues, sometimes things will actually get worse. Not that that's necessarily a bad thing, but you will then be able to see and properly present other co-occurring mental health issues now that are often leading to some of these secondary issues, which are manifesting in the form of their addictions, which are now more capable of not only being identified, but treated accordingly.
So, here's the interesting part. So, does being depressed, anxious, bring about addiction, or does addiction bring about depression and anxiety? It's both.
It is both. Depends on the
Because
circumstance.
Because
Yeah.
I believe it's a disease, and you do not have to have a reason to become addicted. Okay? You could have the greatest parents, sisters and brothers, grow up in the best neighborhood. You name it, everything could be perfect in your life, okay? And yet, those people can still become addicted to a substance or behavior.
I see it all the time.
What does that tell you? Okay? I mean, obviously it tells you that it's a disease, it's an illness, and we know that there's
a genetic component, anywhere from 40 to 60%.
absolutely, based on family studies, right?
Mm-hmm.
So there's a genetic component, and we know that it's not the addict, is he the hopeless drunk? There's a reason why someone wound up there, right? So it's not, you don't have to have, trauma
No.
or an underlying, but in a lot of instances you do.
Well,
But it's not a prerequisite.
it's not a prereq, but again, you do the research or one of the older studies, the ACE study, right? The Adverse Childhood Experience, which basically notes, certain particular experiences that kids could have, whether there was physical abuse, verbal abuse, absentee parents, mental health issues in the house, drug abuse, anywhere from 4 to 10 times more likely to develop an addiction in their life, right? So understanding these factors are why we often see higher levels of addiction in, underserved communities or minority communities too, right? Because these things are present. So the research does help, but it's absolutely not a prerequisite.
So basically, I think we can kind of surmise that the underlying reason why people get addicted is a genetic component, and it's due to the dopamine response. From there, what do we do about it? I mean, how do you proceed when someone comes into your office with an addiction and they say, Josh, I'm anxious, I'm depressed, I've been using coke and smoking pot every day, and I'm at my wit's end, man, and I tried to stop. I can't stop. Help me. Okay? How would you tackle that individual?
I mean, the first thing that I would do is not really far off from some of what we're doing here, which is psychoeducation, right? You want to help take the shame and the guilt and the stigma and the misunderstanding, because most people who are in their active addiction actually feel crazy, right? Because they're intent to do one thing and then they act in opposite action of whatever that is, right? By the time they're coming into me, they know they have an issue. They've probably had issues with family or friends or their job or just, interpersonal, right? Between them and themselves. So you got to start by helping to obviously create an environment of one that's sensitive, compassionate, open, loving. You want to be able to start an open and honest conversation of how addiction looks, how it manifests. You want to normalize some of the experiences and the symptoms they're having. One of the most important things is that after you can give them some of this psychoeducation, you have to give people an understanding that their brain is plastic, right? Their brain was not always this way. And because it is plastic, it can change. And then help them understand that there is hope, but that things didn't get this way overnight and that this is a process, right? And to be patient with it and understand that there are many modalities that people go the road of in order to find their own recovery.
So, I mean, I think what are the major risk factors for addiction? I believe in today's day and age, as opposed to 100 years ago, it's accessibility. We have access to everything at the tips of our fingers, right? Our phone, food, gaming, drugs, alcohol. That was not the case 100, 200 years ago, right? Where our brain was initially wired for scarcity. So we had dopamine hits here and there. In other words, we found food, we ate it. Oh, dopamine hit, right? None of this existed.
No, technology has moved much faster than our evolution.
So basically, we have a dopamine button 24/7. Boom, dopamine hit, right? Anytime we want, right? So we have endless quantity, right? Tremendous potency, right? And novelty, right? And obviously accessibility and availability, right? So I think that's a major reason why addictions today are at a phenomenally high level because of all this that's going on. And I think that almost every one of us, if not addicted, will become addicted to something. Everyone. Whether it be gaming, smoking, drugs, alcohol, sex, porn, everything, you name it, man. Everything. So, when we see that someone's looking at the addict who's, let's say, doing drugs or alcohol, okay, that's a different form of addiction. I'm not saying that's a good thing, obviously, but...
No, but there's a different perception as opposed to the person who's addicted to work.
Right.
Or the person who's addicted to money, right? Like, we reward these people in society. We hold them at high regard, right? People who can function well, who are sleep deprived because they can't stop working or they can't stop doing particular activities. People addicted to, call it sex, right? We live in a world where sometimes we applaud young men for their aspirations, for who they can date, who they can pick up, who they can sleep with.
And they would say it's sexual preference. It's not an addiction, right?
Yeah.
But in actuality, it's an addiction. It's an addiction. I have tremendous respect, and I've gained tremendous respect for the addict who's gone into recovery, okay, and who sustained sobriety, because that person every day has to get up with courage, bravery, honesty, discipline, humility, okay, and resist the temptation of that drug or behavior, which he has an innate disease to do. The hypervigilance that is required for him to refrain is downright heroic, man.
And it's a very honorable cause. I would say not necessarily the nice piece, right? But when it comes to particular substance addictions, one of the very clear, concrete answers towards a solution is complete and utter abstinence, right? But when we start talking about behavioral addictions, it's a bit more challenging, to take a phrase that I took from a sex therapist, Mark Weiss. The crack pipe is attached to the body when we're talking about sex addiction, right? It's not about abstaining from sex for the rest of your life, right? It's about how do I integrate sex in a healthy way. Same with issues around food, binge eating disorders, right? Or people who are anorexic, right? I need to have a healthy relationship with food.
Yeah.
And I need to learn how to use that on a regular basis.
Right.
As opposed to complete and utter abstinence, which by no means is a small feat. But it becomes much clearer of what I can do, what I can't do, and how do I approach that.
What role does stigma play in preventing people from seeking help? Okay. How do we deal with that? How do we combat it?
I mean, most people, as you look at a timeline of perceptions around addiction, right? Still many people believe that issues around addiction are about will. Poor will, you're weak, you're not making good choices, you should be more disciplined, right? as science has shown, that is not the case, right? Then we've moved towards a disease model where like, oh, you're sick, you need to get well. And as we're sitting here and talking, as this definition of addiction evolves, right, we're understanding on a neurochemical level, like biologically, we can actually see structural changes in the brain. So a big piece of that is continuing to have conversations like this and help people better understand like really what is at the core of addiction, like what is causing it on a behavioral level, to help eliminate some of that stigma, right? So many of my clients come in with feelings of shame and guilt without a real understanding of like, you know, if you weren't in the cycle, you wouldn't be doing these things, right? You wouldn't be acting this way. So learning how to essentially separate yourself from the addiction and understanding that you are not your addiction, but your addiction will drive you to act in certain ways. Because when you are in addiction, your addiction is like air. It's like food. It becomes the most important thing. It becomes about survival. And people get stuck and they can't possibly understand why they would steal from their family who has helped support them, you know, or do things that are against their values and their morals. And the big piece that I think a lot of people don't talk about is understanding that the denial is one of the hardest things to combat. Me as a therapist, right? When I'm working with people in my office, there's so much denial, layers and layers of denial that need to be broken through. And that at the core is a huge piece of the addiction that needs to be dealt with.
Yeah. You know, I think also as far as someone trying to recover, when you hear so much about, he was doing so great, and he goes out and relapses, does what he does. Mm-hmm. Is it a trigger? Is it him not being hypervigilant at that moment because he constantly has to think about not doing it? Is there, I've read about people that, they relapse when something good happens in their life.
Correct.
In other words, everything's going great, and let's say they get a new job or something, and that feeling sets off a dopamine surge. Mm-hmm. So it's a mini surge, but obviously it's followed by a mini
drop,
right? Because action, reaction. So once you get that drop off, they want that surge again. And that surge is found in the relapse. Am I right?
Yeah. And the reality is when you look at different models that, are clinically used to approach conversations around addiction, right? So there's a stages of change model, right? So there's a pre-contemplation stage, right? When somebody first comes into your office, maybe they got a DWI. They're there because they need to be. They don't really think that they have an issue, but you're there to have a conversation about it, right? Then you move on to like a stage of contemplation, right? Where somebody feels like they might have an issue around a particular lifestyle or behavior, but they're really not sure what to do about it. They just know something's wrong. Something's not off, Then you move over to, hold on. There's pre-contemplation, contemplation, preparation is the next stage, right? That's where they realize they have an issue and they want to start to take action steps. They're talking to you, your therapist, they're talking to their treatment team, they're planning around what to do, how to do it. Next stage is the action stage, right? Where they start to try and implement these tools to deal with whatever the particular issue is. The following stage is maintenance, which is the continuation of the action steps and implementing this and turning these things into habits in their life. Believe it or not, the next stage is relapse, because relapse is so common in recovery. Yeah. It's not necessarily a failing. It's built into the model because it is real for the reasons that you just mentioned, right? People could be having a good day, a bad day, a nothing day, in the wrong place at the wrong time, and all of a sudden they find themselves, having a lapse.
Yeah. What's the most common physical consequences that you find when you're treating the patients with addictions?
Most common physical consequences?
Health-wise.
Health-wise, I mean, it's amazing how people marginalize the impact of proper sleep and proper food and diet. People don't realize how dysregulating that can be, right? So getting people on a regular sleep schedule and a regular eat schedule.
Yeah.
Because those are often the things to go right off the bat.
Right. Obviously, as a physician, I see much more than that. There's coronary artery disease, there's heart attacks, there's strokes.
But those are not always what bring people in initially, right? Like those are real down the line, right? Like, so again, right, you talk about different addictions, you talk about cirrhosis of the liver, you can talk about, issues in terms of people like it's endless.
Sure. Yeah. And I think we went over the fact that, so whether it's a behavioral addiction or a drug addiction, right? I think physiologically and even psychologically, it's the same. Because I think there is a physiological response even to the behavioral addiction, where you would think it's only from the drugs. You do get those withdrawal symptoms, even from any type of behavior.
Absolutely.
Correct?
I see it all the time. Clients, as far as, these days, gambling is certainly on the rise, and, a lot with sex and pornography as well. It's a lot more common than people realize, but again, those conversations, people often don't want to have them, or when they do have them, they kind of normalize it, as opposed to the reality of when any behavior you're engaging in feels out of control, that's usually where you have a problem, right? It's the belief, it's the denial thinking that you can control it that needs to be broken through, despite all of these negative consequences and the continued engagement in those particular behaviors, right? The same person that has been to treatment multiple times, the same person that has been arrested multiple times or has stolen multiple times or has had issues with family or issues with work, but they are not connecting the dots that it's related to their substance, right? They thought they got unlucky because the cop shouldn't have been there, or shouldn't there have been a DWI checkpoint, or they think their boss is a stickler giving them a hard time about, coming on to work hungover or, not performing at a high level. The denial is a huge piece of what needs to often be broken through in order to help people take that next step.
So the next step, let's talk about AA, 12-step program, okay? Have you done the 12-step program?
So I am somebody who is in 12-step program for AA as well as SLAA. There are no shortage of 12-step programs depending on how your addiction manifests. It's something that I was introduced to probably in my early 20s and was really apprehensive about. AA is what's called a spiritual program, and I think a lot of people often mix what does it mean to be spiritual with what does it mean to be religious. And for a lot of people, they don't consider themselves religious, and it can be a really big turn off from exploring 12-step programs. Once I stuck around a little while, because I realized that despite what I believed or any preconceived notions I had about religion, there were a bunch of people in these spaces who were doing something that I wasn't doing, which was staying clean and sober for extended periods of time, which I was not able to do. So obviously these people had something or knew something that I did not. And that was the beginning of why I was a bit more open to it.
What's the essence of the 12-step program? From what I understand, it's giving up your disease to something, to a higher power, right? Obviously, I call it God, right? Some people just say the universe or something else, right? where you know that you are helpless in helping yourself and you need help from something greater.
12-step programs, step one, right, is admitting that I am powerless over whatever that particular drug, substance, or behavior is, and that my life had become unmanageable, right? That is step one, right at the core.
What would you say keeps a person in the 12-step program?
So it's a great question. One of the things that try to get framed early on when people find themselves in a 12-step program is understanding that the drugs or the habit are not necessarily the problem, right? When you take the drugs or the habit out of the equation, what are you left with? You're left with yourself, right? I am the problem, right? There are issues with me, with how I think, with how I function, with my connection or lack thereof. So it's really about recognizing that 12-step programs are not necessarily just about abstaining from drugs and alcohol, right? They're a series of steps, a way to choose how to live your life without those things, right? Because the reality is when I came into this program, I didn't know how to live my life with these particular substances. Well, now that I took this substance out, I'm just learning how to live life, right? How do I do that in a way that is functional? How do I do that in a way that's self-respecting? How do I do that in a way that aligns with my values? How do I do that in a way that feels manageable, right? Because often when you take people who come into program, doesn't matter what your story is or where you come from, a lot of what people talk about and present is the same, right? They come in with issues of poor self-esteem, low self-worth, lack of confidence, poor boundaries, not knowing how to communicate, a lack of a connection, right? Feeling disconnected from people in the world. There's a saying, right? The opposite of addiction is connection. And it's not necessarily just connection to people, it's connection to places, to things, to interests. So 12-step programs are a series of people who are non-professionals working together in collaboration based on a certain text and utilizing that text and integrating it into their lives and taking people who have past experience and basically paying it forward. So if we fast forward to the 12th step, is having had a spiritual awakening as a result of these steps, I paid it forward to another addict or alcoholic, right, which is what starts the cycle.
Which is what is kind of a self-gratifying type of thing, as obviously helping someone else.
So it does give you a sense of fulfillment, right? To be able to not only help somebody else, right, but to take your experience that used to carry so much shame and so much guilt, right, to reflect on this thing that I did in my life that caused me chaos and crisis, but have actually found a way to create meaning out of it by being able to talk about it with somebody else. Not only does it help them, right, but it also helps me create a sense of meaning, right? It gives me a sense of fulfillment because part of addiction at the core is just like the disease of I, right? Me, myself. I'm always thinking about myself. What do I need? What do I get? How do I get this? Where do I go? It doesn't often incorporate the we, right? In 12 steps and there's traditions, right? They say that the steps are so I don't kill myself. Those traditions are so I don't kill other people. Yeah. And there is a lot of substance within the program. And one of the reasons people stick around for so many years, because let's face it, right? Somebody can get sober for a year, and all of a sudden you're like, why is this guy still here 30 years later?
Right.
Because it's not just about staying sober, right? This is a program of how to live your life.
Yeah.
Based on certain principles and certain beliefs and certain systems.
People that I know who were addicts in recovery, they consider this a gift. They consider their addiction as being a gift. Would you say that your recovery from your addiction is a gift, meaning, again, that it's changed you in a way and it's made you into a person that you would have never been if it wasn't for what you went through and if it wasn't for the gauntlet that you rode through?
Absolutely.
Right?
It's been the gift that does keep on giving.
Right? Because it changes you as a complete human being. In other words, you were a broken human being, right? And you accepted the fact that you were broken, that you were in pieces, and that you needed help, right? And through that brokenness, okay, you developed a humility, honesty, a self-respect for yourself and for others that would have otherwise not been possible. Is that fair to say?
Absolutely.
Yeah. Was the limiting factor of you being an addict, you yourself? I mean, do you think that your addiction had a cause, or you became addicted because it just happened? There was no reason. So, I kind of know you a little bit, and, you had good parents, grew up in a nice neighborhood, and you kind of didn't have anything that stood out flagrantly.
No, but here's the thing. As far as recovery goes, there have been many different pieces. I owe a lot to my therapist. I owe a lot to AA. I owe a lot to various bodies that have had an influence on my recovery. And I've learned that as picturesque as families are on the surface, that there is or was a certain level of dysfunction that I really wasn't privy to. In my home, I grew up where, there was a family member who was in active addiction, but they were functional, right? So they weren't your typical drug addict or alcoholic on the street, breaking laws and, doing evil things. They were still getting up, going to their job, coming home, supporting a family, which, in fairness, being the son of an immigrant, first generation in this country, I completely understand, and my father did well for himself. But the reality is that, he did struggle in his own way. So
you had genetic predisposition.
There was genetic predispositions, and there were other elements in the home that definitely played a role. Yeah. Not to mention, being a kid is hard. I was a kid who was insecure. I was overweight, somebody who got made fun of when they were younger. And a lot of these things create a child who's very vulnerable, right?
Many traumas, so to speak, maybe.
Call them mini traumas, not traumas.
Yeah.
Listen, these are just elements of life. But the reality is that young adults, right, we still have developing brains. So we are part of the vulnerable population, right? The younger you are when you first explore using drugs and alcohol, the more likely you are to develop an issue around that particular substance. And part of my experience was getting introduced when I was young and I was vulnerable. As we know, the teenage brain is still developing. Even though teenagers can do some amazing things with their bodies, the parts of their brain that are responsible for emotional regulation are not fully formed, right? Which is why parents call them the terrible teens. We could be having the best day of our life and the worst day of our life. Kids could be sad and suicidal, even though on the surface nothing is going terribly wrong, because they don't necessarily have the tools to help themselves regulate their emotions. If an adolescent gets introduced to drugs and alcohol, which can help to regulate their emotions very readily, they're likely to continue to use that. What they don't realize is that they are hijacking their brain's natural development cycle in building the ability to learn how to regulate without the use of those substances. So all too often, and I would say myself included, you can have people that use at a young age. They can get through college, they can get a first job, they continue to use.
Just be functional.
They're functional. And then, they do hit a speed bump. Let's say they want to explore a particular area of work or field, whether it's medicine or they want to explore aviation, where there are restrictions against using particular substances for obvious reasons. They are not taking these things out of the equation, and they are really struggling, and they don't understand why. And for me, when these people come into my office, part of the education around this is helping them understand that despite hitting certain milestones in their life for the last 10, 20, or 30 years, they still have the emotional maturity of a 15-year-old.
Yeah, they're infantile in their way, right?
Yeah.
You kind of revert back, right?
Mm-hmm.
Something about AA, they talk about one day at a time, right? I guess they say that it's not about that one day, but if you can do that one day correctly and right, and you can sum up a string of days, those days turn into weeks, which turn into months, which turn into years, and then all of a sudden you look back and you say, hey, I did something. And I think that's kind of the definition of that one day at a time thing, right?
I mean, it's absolutely a piece, for a lot of people when they come in, they can't imagine, right? As soon as they're, 20, 21, trying to get sober, 30. I mean, generally people aren't coming in at 21, sadly, right? They haven't hit their proverbial bottom. People will come in, and one of the first things they think to themselves is, how am I not going to drink at my wedding? And here's a single 30-year-old having a conversation with me. They're worried about if they're going to have a drink at their wedding with their non-existent partner. Right? So one day at a time is also about making things feel accessible.
The here and the now.
The here and the now. Sometimes it's 1 hour at a time, right? For people in early recovery, it's understanding that you're still going to get cravings and urges to use, right? So we teach them about urge surfing, understanding that there is, a height, right? If they can hold off for 15 or 20 minutes, odds are that craving or that urge will kind of tailor off. And we teach them, right, like behavior modification. So when you have these feelings or these urges to use, right, we need to replace one thing with another. I often try to use the analogy for clients when they have particular addictions. Imagine life is like a cold day, right? It's a cold day outside. What happens when you get cold? You want to put a layer on, right? Imagine your addiction is the jacket. Now we take the jacket off. It's still cold outside, right? So we got to give you a blanket. We got to give you a hat. We got to give you gloves. Part of my job is to give you tools, to give you coping skills, right? The drugs and the alcohol served a purpose for you.
Sure.
Now that we're taking them out of the equation, we can't just leave you out in the cold to freeze, right? We need to give you tools to deal with it. And that's where recovery comes in, right? That's where 12-step programs play a role. That's where therapists play a role. And for some people, they need a higher level of care, right? Just like they may need to go to residential treatment. They may need to go to outpatient. They may need MAT, right? Medication-assisted therapy, depending on how severe their issues are or what are presenting. So again, a lot of recovery is really, a lot of it's about education on the part of the professional. As far as, the client or the subject, it's really about a willingness.
The typical addictive brain, I believe, says that, life this isn't interesting enough. And that's how they seek out the dopamine hits, where you have to know that life is not going to be dopamine surges 24/7, right? And you have to get used to the boredom, because the boredom is good. It's part of life, right? It's it's what you need and could be self-reflective, right? And learning that, what can I do right now, right, to be of usefulness right now, okay? Whether it be taking out the garbage, painting your door, helping someone else get out of the car. It's about the here and the now. Not that that's going to be the meaning of your life, but that's the stepping stone, right, to achieving the higher things in your life, right?
So I would say yes. Sometimes it's also just about sitting with discomfort, right?
Right.
Sometimes
Right.
there isn't always a
Right.
thing to do, a place to be, a meaning to be had.
You just got to sit with it,
Yeah.
right? And and I think you need a humility, right, and an honesty about yourself to say that life is hard, man. Life's a struggle. It's not easy, and we're all kind of figuring it out. Oh, everyone.
Mm-hmm.
And the person who says they have no regrets, well, that's preposterous, man. I don't know if any human being does have a regret. I have regrets, plenty of them. You know, you wouldn't be human if you hadn't have regrets.
Absolutely.
You know? So I think once you get to that level, that's how you can be successful in recovery. Am I wrong?
Well,
All
no,
right.
you're not wrong. I will say, as far as when you talk about regrets, one of the ways you try to frame things for people, it's almost like when you're in a car, right? Like you can be aware of the past, and that's what your rear view mirror is for. But if you don't keep looking forward, right, you need to use the windshield. You need to continue to look forward, to move forward with your life. You can't just keep looking back. So it is important to recognize and normalize people who do have regrets, and that it is okay, right? And that's part of learning how to accept what has happened, right? No amount of regret is going to change the past, right? No amount of anxiety is going to change the future, right? So that's why, we call it the present, right? Because it's a gift. And teaching people how to reframe where they allow their brains to focus on and what they tend to do in those still moments, right? Because the brain, it's like a monkey, right? It's untrained. The brain just wants to think. It wants to wonder. On average, we have some like 80,000 thoughts a day between our waking life and our sleeping life. If you do the math, it's a thought like every 1.5 seconds, give or take, right? We can be victims to thought, right? And this is where another piece as far as treatment, right? Like cognitive behavioral therapy, right? Like based on what I'm thinking about myself, a situation, that is going to impact how I feel emotionally. And my emotions are often going to impact how I act or behave. So if I continue to ruminate on the past and issues of regrets or things that I've done wrong, guess what? I'm going to feel terrible. I'm going to feel guilty. I'm going to feel shameful. And guess what? Then it becomes hard to move forward. It becomes hard to take positive actions for myself. And that's how people get stuck. And this is just one small piece of understanding not just life and how to deal with it on life terms, but this is universal.
As far as treatment options, I mean, we've gone over the cognitive and AA. I hear about psychedelics, right? Psilocybin, MDMA, ecstasy, right? I have my thoughts about them, but I want to hear yours.
So it's still a lot of trial going on, right? There's a lot of testing going on. They're trying to refine this process. As you may know, more like ketamine clinics are popping up. People talk about the use of ibogaine or iboga, ayahuasca. So there are psilocybin, as you mentioned, like mushrooms, people are microdosing, and a lot of this stuff is kind of being normalized in this day in society, but a lot of it isn't being done in a systematic way, right? Like it hasn't, a lot of people are just exploring these things on their own terms versus doing this in a controlled environment. So I know people that are actually practicing this on a clinical level where they're working with a doctor who prescribes a certain dose, and then they're going on spiritual journeys with their clients where they're sitting in an office with them for 3-4 hours at a time, talking through some of these experiences. Because again, whether it's ketamine, whether it's psilocybin, what these substances have been shown to do is help to expand the brain to make certain subject matter a bit more accessible and make your brain a bit more amenable to certain ideas and certain concepts that you could then later implement in your waking or your sober life after the fact. But a lot of this stuff, from what I've learned, again, and I've had clients come into my office who have talked about utilizing ketamine and being in an office where a doctor just gave them ketamine, had them sit in a chair for about an hour and a half, and kind of sent them on their way. Ketamine is a powerful drug. It's a dissociative, if I'm not mistaken.
Yep.
And there was not much clinical value for this particular person.
You jump off a bridge after that, man. I mean, yeah.
And again, it's more just recognizing that it's a very new field, and I think there's a lot of value and merit. Like, I could speak openly that this is something that I've actually explored too. I've explored it in recreational ways that I thought could be potentially medicinal, and I don't really think it was overall. It felt a bit more recreational, as opposed to, things like, again, ayahuasca, right? So when people go on ayahuasca journeys, depending on where you do it, who you do it with, how much work you put into it preemptively, what are your intentions setting, what are you here trying to do? There's a lot of prep work that goes into a lot of this stuff. And some people think it's a quick fix or it's a fast fix. And it's still a relatively new field. So I don't want to say the jury's out, right? I think we're still figuring it out. I know there have been a lot of studies as far as MDMA, and for soldiers and for people who struggle with PTSD and have found a lot of help with these MDMA-assisted psychotherapy sessions. I myself, I'm not at the forefront of this movement because it's just not my current practice. So I am still waiting as more and more information comes out and learning more about it before I decide to dive deeper into it professionally.
Yeah, I'm going to say that, I'm skeptical. I really think that using these substances can make someone worse. And most of the time probably does. Now, I think there's a place for them. I think that...
And you do need to meet, from what I understand, if you're doing it properly, certain criteria, right?
Absolutely.
Like people with certain mental health issues or certain history of,
Close
psychosis or things like
psychotherapy.
that.
Right.
You're probably not going to qualify. Right. You're going to get screened out for some of this.
I mean, I think that it could help with trauma, with other things where substance abuse wasn't the initial problem, right? But when you're dealing with someone who's trying to recover from drugs or alcohol or what have you, I think it's just a recipe for disaster in the end. That's my opinion. I think that you become just more susceptible to wanting to do it for the dopamine hit. That's my thinking,
And for some people, I would say that it's accurate, and I've
Right.
seen it, right? Like people who have used ayahuasca, right? Generally, it's not supposed to be something that's repeated again and again over many times. And when I went on my own retreat, I actually found myself with people that were going on their 10th, 12th, 16th journey.
Right.
Which boggled me because let me just say it was a very harrowing experience, and not necessarily in a bad way.
Yeah.
You know, and at the end of my experience, truly the message that I got was that I actually already have everything I need, which made it very easy for me to choose to step away. What was interesting was when I was with other people trying to ask them about their experience, some of what they shared with me was that they were getting reoccurring experiences from previous trips or journeys that they've done before. So my question to them was, so if you're getting the same experience over and over again, like, what are you doing with it when you leave here? Right? What are you doing with this experience? Or are you just here for an experience? Right? And I think some people, it's really not clear what they're doing there.
Yeah. Maybe they're just there for the high.
Yeah.
Right? They're here they're reverting back to what they've been. Well, I think we've covered quite a bit. Okay?
I think so.
Yeah. It was nice having you. Do you want to add something to this or anything that kind of? I mean, we could sit here and talk for hours, but we're going to have to end the podcast sometime.
That's
so.
Fair. You know, the only thing I would say, and I know we didn't really get to touch too much on it. You know, we talked a lot about the addict, right? We didn't really talk a lot about the family. We didn't talk a lot about the people who were affected by it outside of that person. You know, we didn't talk about, you know, enabling or codependence and, you know, understanding that the addiction is more often than not a family disease, because often what happens is people get out of treatment and they go back to the same dysfunctional home that part of the dysfunction is what perpetuated the issue.
You're back where you started. Yeah.
So the importance of families getting help, families going to therapy, going to family sessions, families going for their own recovery, like Nar-Anon or Al-Anon and things like that, is so vital for the entire family unit to thrive and for everybody to recover. Because let's not forget, right? The parent was dead sober when they found their kid sick and rushed them to the hospital. The parent was dead sober when they found out that, you know, their kid was missing or in, you know, unsavory places or doing, you know, illegal things. And these are traumas for family, right? Like they are also damaged from this and they need to heal together. So,
and I think that you're right. But I think that so often that members of the family look upon their son, daughter, brother, sister, what have you, as, you know, again, oh, he's just an addict or just a hopeless drunk or a pill popper, you know. And until you can change that mindset, okay, and realize the true essence of the disease, which it is, okay, then and only then can everyone in the family, right, heal, combine. Because then there's an understanding, right, about what's going on, okay? And again, that's not to say that, you know, you should lay down the law or have boundaries or be strict in your
and we
disposition.
Call that detaching with love, right?
Right.
To not enable certain things where, like, we want to see our kid feel okay or feel better, but recognizing that sometimes the things we're doing to help our child are actually
hurting,
perpetuating the problem.
Yeah.
You know?
Yeah, and it's out of love, right? I mean, unfortunately, and this is what they teach, is that, you know, you have to kind of have boundaries and
allow your kid to have consequences too.
Right. Yeah. Consequences. Yeah. But great. All right. So we're going to wrap it up. Thanks again.
Thanks for having me.
All right. Pleasure having you. And I'll see you next time. I want to thank everyone who joined us today. I hope you found this discussion helpful and of interest. And if you know of anyone who would also find this helpful, please share. This was not intended to be medical advice, just conversation, information, and education. Listeners and viewers should always consult with medical professionals for advice and guidance. Thanks again, and stay tuned for part 2. God bless and stay well.